Hey everyone, it's Bianca here, and I am going to talk to you guys today about the substance nicotine and its relationship between sports performance enhancement. I will be discussing today in this video the pharmacokinetics of nicotine, as well as its physiological uses and some side effects associated with nicotine use, and also some research supporting its use towards enhancing sports performance. Let's get started. Hey Molly!
Hi.
How's it going?
Good. How are you?
Good. Do you think I could ask you some questions? Are you busy right now?
Sure.
All right, cool. Have you heard of nicotine?
Yes.
Do you know what it is exactly?
Yes, it's a drug found in tobacco. It's addictive.
Okay, yeah, it is. It's actually a psychoactive compound that is only found in tobacco. You can only get it from tobacco, and it stimulates the central nervous system.
Got it.
Makes sense, right?
Yeah.
Do you know what kind of products it's found in?
Cigarettes, and that's it.
Cigarettes, okay, yeah. Cigarettes are the most common, but there's different things like there's smokeless tobacco, so chew, dip, snuff. So we are aware of the most common form of nicotine, which is cigarettes. Nicotine is a substance that is water-soluble and readily absorbed through the skin and lungs. Because it is a strong base, it is not absorbed well in the acidic environment of the stomach. This image shows the metabolism of nicotine. It is extensively metabolized in the liver. In humans, about 70 to 80% is converted to cotinine. Nicotine has a half-life of about 2 hours, and its metabolites are readily excreted in the liver and also in breast milk. In the late 19th and early 20th century, chewing tobacco was by far the most popular form of tobacco consumption in the United States. Other forms of smokeless tobacco, such as dip, snuff, and also the Swedish import snus, were also widely used. Because baseball players feared that cigarettes would cause fatigue and even bad luck for their performance, they stuck with chewing tobacco. It was common for the infielders to use it to keep their mouths moist when playing on the dry fields, and also they used the spit to soften their gloves. Tobacco use and rodeo also have a long intertwining history together. The Professional Rodeo Cowboys Association was sponsored by the U.S. Smokeless Tobacco Company from the years of 1986 to 2009. Currently, they are no longer sponsored by them. It was common for tobacco companies to use top athletes such as Babe Ruth to market their products. And also, these athletes had no problem using these products. So what makes this substance so special? Molly.
Hi.
So I wanted to ask you one more question. If I told you that there were other forms of nicotine that would bypass the respiratory system completely, and these same forms of nicotine can help improve your performance as an athlete, would you be willing to try them out?
I don't think so. But how would those work?
So how these substances work is they activate the sympathoadrenal system, which leads to an increased heart rate, increased contractility and vasoconstriction, and also a rise in blood pressure, and also increases the level of circulating catecholamines during exercise. So it will increase your blood flow to your muscles, and it also will increase lipolysis due to increased levels of norepinephrine and epinephrine throughout the body. So basically what the physiological effect that nicotine will have on an athlete is that a study done actually by researcher Muendel showed that there was a 17% improvement in the time to exhaustion for the athletes. So they were able to perform better because they were not as tired. And they used a nicotine patch. So they received nicotine through their skin. They didn't have to smoke or chew or anything.
Interesting.
Interesting, right?
Yep.
Nicotine is a highly toxic drug, with only 60 milligrams being lethal to an adult. The average cigarette contains 8 to 9 milligrams of nicotine. Nicotine doses vary depending on the type. The common doses that present a strong effect contain at least 2 milligrams of nicotine. There are many different effects of nicotine shown in this diagram. Some of these include nausea, vomiting, salivation, diarrhea, dizziness, mental confusion, and weakness. At high levels of exposure, nicotine causes decreased blood pressure, difficulty breathing, irregular pulse, convulsions, respiratory failure, and death. Nicotine is one of the most addictive drugs readily available to the average person. One of the major issues with consistent nicotine use is the severity of its withdrawal symptoms. The withdrawal symptoms include irritability, anxiety, restlessness, impatience, increased appetite, and weight gain. Nicotine is currently under review by the World Anti-Doping Agency. How it works?
Oh, it's recording.
Yeah, it's recording. It's fine. I'll cut that part out. Okay. Work is they actually activate the sympathogenic crap me in the face. I can't say that. And they didn't have to smoke or chew or anything.
Interesting.
Interesting, right?
Yep.
A minute!
Oh.
Go away.